welcome in to Our Health. And again, we are so fortunate to have with us Dr. Ben Cason. Ben is a Montgomery man, and he's back home to practice surgery, and we are so happy to have him. We're going to talk about something today that, as far as I know, reflects, almost everybody I know
Absolutely.
Has a problem with acid indigestion or reflux problems. And we would like to talk about surgery for that today. And Dr. Cason, on the reflux issue,
Yes.
tell us something about how we can work with that.
Well, reflux, like you said, is a very common problem. Most everybody has an issue with reflux at some point in their life, and usually it's pretty mild and self-limited, and we can say, that was just something bad that I ate, and I don't want to eat that again, or especially not right before I go to bed kind of thing. But there are some people that have very serious problems with reflux, that take medication for it every day, that have to sleep up on pillows, that have to avoid foods all the time that cause a trigger. And for those people, if medication stops working for them, or they just get tired of taking the medication because of the side effects, or they just don't want to take a pill every day, there are operations that we can do to effectively stop reflux. And there's several out there, several different operations. And each one is based on what the particular problem is. So many people have heard of the term hiatal hernia, and that's where the stomach, the stomach actually slides up and down within the chest, and that's a major cause of reflux that is easily surgically repairable. And we can go in and actually repair the hernia, and that will prevent the problem.
So while that's happening, it's forming kind of like a blockage, and eases, and then it lets itself go.
So some people have a problem with the blockage with the hernia. A lot of times what happens is it goes up, and the body has a natural valve that prevents stomach acid from refluxing up. Well, when the top of the stomach goes into the chest, that valve goes away. And so it basically just opens it up, and things just go the wrong way. Right, that's exactly right. And the way to fix that is by pulling the stomach back and actually closing that hole up and tacking the stomach so that it doesn't slide up and down anymore. So that's a common problem. That's a common surgical repair for reflux. And then sometimes people just, for whatever reason, don't have that good valve, and we can use surgical techniques to basically create a valve that prevent reflux from happening. And the reason we do that is partially because it's very inconvenient and very bothersome to have constant heartburn. But the other problem is that some people can actually develop chronic problems. They can develop cancers, they can develop blockages in their esophagus, and other problems that occur just because of that reflux. And these operations can help us prevent that.
So our audience are people that are, primarily 50 years of age and older.
Right.
Do the incidence of that increase as we age, or because obviously, like anything else, we're starting to deteriorate a little bit?
Right.
Yeah.
Right. That's the age group that we see most often with this. Is 60s and up are going to have problems. Now, younger people do have problems with reflux as well, but that's the kind of the age range that we're looking at a lot of times. And it doesn't really improve with age. And so,
I wouldn't think so.
Right. And so, again, medication will fix it for a lot of people. But in those people that it doesn't, or that just don't want to take those medicines every day, we do talk to them about how to do this, how to get it repaired.
Well, let me
those
ask
medicines are costly, aren't they?
They can be. They can
be,
especially on people that need double the dose of the normal medication, which a lot of people that have bad reflux, they're on double dose medications. And those medications have their own side effects. They can cause other infections.
Yes.
They can cause just having a lot of bowel issues. And so it's important that people understand that there are risks for everything that they do. There are risks for taking medicine, there's risk for surgery. And that's where I come in, to be able to have that balanced discussion and decide whether surgery is the right thing, because it's not always the right thing for everyone.
Right.
And that's why not everybody gets reflux surgery. But for the right person, it could be a life changer.
Well, and the recovery period is probably pretty good for that, I would assume.
It is. So for most people, they come in, we do the operation either with a laparoscope or with the use of the Da Vinci robot device.
Okay.
And that's a minimally invasive operation where we, and the hospital stay is generally 1 to 2 days after the surgery.
Wow.
And you'll be on a liquid diet after the surgery for a few days, and then you slowly progress back into eating whatever you want to. So the total recovery is usually on the order of about a week or two after the operation.
That would be so well worth it for people that have suffered with that forever. Well, thank you so much for being with us.
You're very welcome.
It's just nice to know that we have alternatives, and we have ones with very short recovery and minimal invasive procedures. So Dr. Cason, it has been wonderful to give us an option about some of those things. Stay with us and we'll be right back.